Hi friends, today we are going to discuss an OET role play card. This is the setting for the nurse. So whenever you get the role play card, first what you have to check, what is the setting. So here the setting is a home visit and our position is a nurse and the task is explained. But before that we have to see the background settings, background information. So let's see. Here, a general practitioner has asked you to visit a patient who has diabetes mellitus diagnosed recently. The diabetes has been moderately well controlled by diet and oral medication. However, recently the patient's blood sugars have been high and the doctor has decided to commence insulin injections. The doctor wants you to explain to the patient how to give himself or herself the insulin injections. On arriving at the patient's home, you find that he or she is very unsure why he or she needs insulin injections and very nervous about the procedure of administering the insulin. So, what is our task? Explain to the patient when requested why he or she needs insulin injections. Then explain slowly and clearly the whole process of giving the injection, including using clean needles, administering the injection, sites for injection, etc. Try to reassure the patient that he or she will be able to manage the injections. Emphasize the importance of safe needle disposal, suitable containers, proper care, and handling. So once you read these informations and you understood what you have to do, as it is a home visit, you can ask the name of the interlocutor or the patient, how may I address you during role play. Like that you can ask to the interlocutor because you have to introduce them during role play. You cannot ask the name because you know the patient and to whom you are going to meet. So it will be nice. So how we can do? Suppose this patient's name is Alex. So once you reach the home, can ask, is this Mr. Alex's house? Then if it is the patient, he will tell, yes, it's Mr. Alex's house. Or somebody else also can come out from the house, isn't it? So we have to make sure you are talking to the right person. Then if in case they're telling, then they will tell it's Mr. Alex's house. So you can introduce yourself. Okay, I am Miss X, a community nurse from this locality. And I am here to talk to Mr. Alex regarding the insulin injection administration, like that you can tell. Then you can ask what you can ask. Am I talking to Mr. Alex? As I mentioned before, someone else also can be present at that house. Okay. So you should clarify or confirm the identity of the person. Then once you confirm, then you should ask them, is this the right time to talk to you, Mr. Alex? Maybe they have some other priorities. This is not their priority, means we cannot force them or interfere them. So we should assure that they are available to explain this. Then we can tell, yeah, I know your doctor GP suggested to start insulin injection because your blood sugar levels have been high. Then we can ask, so let me explain regarding the insulin administration. So once if they are ready, they will tell you, yes, yeah, you can explain. And then, so how are you feeling regarding this? How is about this suggestion from the doctor? Then he will tell, oh, I was managing with the medications. Then the doctor has said, so I'm so stressed about the situation because this is the new thing. I'm going to administer injection. So it make me so worried like that. They will convey their difficulties or worries. Then as a nurse, what you should do? You should reassure them. Yeah, see, Mr. Alex, I know it's a difficult situation for you. Then we can emphasize, if I were you, I may feel all the same. So we are just assuring them. So, but no need to worry. I'm here to help you. We all are here to support you. Just reassure him. Then we can ask him, so what do you think of this administration of insulin? Do you have any idea? Or are you able to do it by yourself? Then the patient will tell, I don't know anything. So no need to worry, I will teach you how to administer this insulin. Then we have to explain the types of insulin. There are vial insulin available, and nowadays the pen insulin, which is more convenient or easy to administer. It's up to them. They can opt whichever they want, which is easier for them to inject. So you can tell, I suggest you to take this penicillin, which will be easy for you to administer because it's a very pre-filled syringe and the needles are very small, so you can administer. Then you have to ask in between, are you able to follow me? So do you have any concerns that I need to address this time? So don't speak continuously, okay? Then the patient may ask where I can administer the injection. So you can tell, no, I can sense your feeling, no need to get panic. I will explain in detail. If it's a vial, you can have to get it from the fridge and keep outside to make it normal temperature. Then don't shake it and use alcohol swab to clean the lid and extract this insulin from this one, the correct dose according to the blood sugar level. Then you should change the needle before administration and change the site frequently. So before you administer, you have to clean the site with the alcohol swab, and after administration don't rub it because it will speed up, accelerate the absorption of insulin, which can lead to hypoglycemia. We should explain that one. Then you should return to the vial to the fridge and the needle should be disposed safely. Then you can tell, I will provide the sharp box in order to dispose the needle safely, and I will collect it when I will come next time. So no need to alarmed about it, okay? And in between you should reassure them, I can assure you, if you follow my advice and by practice, you can also administer this medication without any assistance by yourself like that. So it will boost their confidence level. Then regarding the sites, you can tell, I will explain the size. As I told you before, you should change the site. You can administer on the bilateral arms, upper arms deltoid area like that, or the thigh and abdomen. But even though they are not looking to your medical knowledge, whatever they tell, it should be convinced for them. So they are just looking at your language proficiency, okay? Then what else? After explained, we can ask them again, is it clear for you or do you have any more concerns? Then just assure them, I will come to teach you or observe your administration for 2 to 3 days, so you will become confident. So that one, then you can just tell them, if you have any more concerns, you can contact me on this number like that. Then you can just provide number, no need to tell this is my contact number like that, you can just provide. So that's enough. I think it's clear for you. Thank you for watching and supporting. Thank you. Bye.